This is Iman Muwaffaq Muslim from the College of Education for Women, University of Baghdad. Assalamu alaikum. Conversation and information. You need to see a doctor. General information. When you go abroad, you have to know the system of the medical treatment of the country you go to. For example, citizens of many of the European countries have EHIC, which means European Health Insurance Card, so that they can get free or discounted medical treatment throughout Europe. But the visitors from outside Europe have to pay for treatment. The first step. What is the first step to do? The first step is the most important one before seeing a doctor. In this step, you need to register as a patient. Thus, you have to go to the receptionist and tell her to register. We have this dialogue as an example. Hello, I'd like to register as a patient, please. Well, you need to fill this registration form first. Take care. We'll call you later. Please take a seat and wait patiently. GPs and specialists. This is another kind of preliminary dialogue in which you hear the term GP. What does this mean? How may I help you? I want to check up. Where should I go? Here we have a GP and a specialist. What does GP stand for? It stands for a general practitioner. What do general practitioners do? They provide consultations, initial medical care, and make the correct decision for further care in an appointment. As a student, you can register at the medical practice, where you can either go or make an appointment, which is mainly within 2 days. You can get the following services at the medical practice. Blood test. And here you can see the nurse from Monday to Friday. Home visits. When you are very ill, but you must call before 10:30 in the morning. And there is an emergency number to call when you are sick out of work hours. And you can get advice speaking to a nurse or a doctor between 11:30 to 12 every day. The Well Person Clinic is for getting advice on diet, smoking stress, and blood pressure checks. The special clinics are for asthma, diabetes sufferers, a baby clinic for new mothers. And you can repeat prescriptions. Checking you understand. It is important to make sure that you have understood. A good strategy is to repeat the important information. For example, the doctor tells you you have to take a tablet every 8 hours. You can make sure using the following expressions. So I need to take one tablet every 8 hours. So you mean I should take one tablet every 8 hours. So you are saying I have to take one tablet every 8 hours. Using stress. This is another strategy for either to make sure or to correct misunderstanding. How is the stress used in the same expressions? So I need to take one tablet every 8 hours. So you mean I should take one tablet every 8 hours? So you are saying I have to take one tablet every 8 hours. Symptoms you have to know. Splitting headache, feeling dizzy, migraine, can't unwind or relax, can't switch off, insomnia, having stomach cramps, feeling nauseous, having diarrhea, fever, feeling lethargic, lacking in energy, depression, pessimistic, feeling tense, irritable, having watery eyes, sneeze a lot, feeling breathless, having high temperature, shiver, sweat. Good health.